Before we talk about keto flu, let's quickly revise, especially if you are new here. Belly fat is a fuel problem, not a motivation problem. When you lower carbohydrates, your body starts changing its main fuel source. The early weight loss many people see is mainly water and glycogen, not fat. And the fuel switch is what leads us into the next topic, keto flu. For a full explanation, see earlier videos in this series. Now let's talk about keto flu. Keto flu is not an illness. It is not dangerous. It is a temporary phase that can happen while your body is changing its main fuel source. Understanding what's happening in your body helps reduce fear and confusion. This talk was compiled by Dr. Siva Navaratnam and ChatGPT, my educational partner. I would also like to thank my children, Dinan and Jazara, for helping me in the production of this video. Keto flu is not an illness. It's simply a temporary phase that can occur while your body is learning to switch from using carbohydrates to using fat as its main fuel. When carbohydrates are reduced, the first things that can change are not body fat. Insulin levels fall, glycogen stores are used up, and with glycogen, water and salt are lost. This early fluid and electrolytes shift explains most early symptoms people call keto flu. Glycogen is how the body stores carbohydrates, and glycogen holds onto water. When carbohydrate intake drops, glycogen is used up, and the water stored with it is released. As this water is lost, salt and electrolytes are lost as well. This temporary fluid and electrolyte shift explains many of the symptoms people call keto flu. When fluid and salt are quickly lost, blood volume and blood pressure can fall slightly. Electrolytes such as sodium and potassium play a role in muscle function and nerve signaling. Until the body adapts to using fat and ketones more efficiently, some people may feel unwell for a short time. This phase is temporary. Some people experience a few common symptoms during this early transition. These can include fatigue, brain fog, headache, dizziness, or muscle cramps. These symptoms are not dangerous and are usually related to fluid and electrolytes shifts, not fat loss or muscle loss. Most importantly, they are temporary. All this happens because insulin levels fall when the carbohydrates are reduced. As insulin falls, fat burning increases, but the body hasn't fully adapted to using fat and ketones yet. This temporary gap between the fuel change and full adaptation explains why some people feel unwell at first. The good news is that keto flu can often be reduced or avoided. The first step is staying well hydrated because fluid loss happens early. Adding salt to meals, paying attention to electrolytes can make a big difference. It is also important not to cut calories too aggressively at the start. Your body needs energy while it adapts. In the next video, we will continue with practical tips to make this transition easier. Safety and when to seek medical advice. If you have diabetes or you use insulin or sulfonylureas, if you take blood pressure medications, if you have kidney, liver or heart disease, if you feel persistently unwell or symptoms worsen, speak with your doctor or healthcare professional. Thank you for watching.